Oh, okay.
Okay, we're here with Dr. Harrington, and you are with the GuardaHeart Foundation, correct?
Yes, that's
and
correct.
also you helped develop the Pulse
Cardiac
Pulse.
test.
Sorry,
Yeah,
Pulse.
yeah.
I want to say it backwards. Sorry.
It's okay, it works. That works. Yes, I did. I led the team that developed the Puls Cardiac Test. It was a collaborative effort between multiple institutions and multiple really great people, and we got it done.
So what made you decide to create the product?
Well, we saw too many people that were getting a clean bill of health, looked healthy, had normal blood cholesterol levels, and they were having heart attacks. And we figured, you know what, we can do better. And so we studied the disease, and we identified the fact that the earliest injury that causes heart disease is everybody's heard about free radicals. Well, they actually do damage. And what we learned is that we could detect the body's immune signals to that injury and use that to identify people that had very early heart disease with no symptoms at that point, and that allowed us to intervene with lifestyle changes or doing preventive things to keep them from ever having a heart attack. And it's just a simple blood test, measures 9 different proteins in your blood, and it's covered by most insurance. And our goal is to make it the standard of care, so that we have people focused on preventing heart disease rather than treating it after it develops, because that's where most of the money is right now. And so we're trying to change that paradigm.
And whereabout is it located? Like where? And is it any doctor's office, or where can people find it?
Well, we prefer most doctors to be certified to use it, but if you go to the pulsetest.com website, www.pulstest.com, you can find an area on that website where you can send them a request, and they'll tell you doctors in your area that can get the test for you. It has to be ordered by a physician. And the other area that you should go to, which is very important, because the GuardaHeart Foundation is all about educating people about preventing heart disease. It's a not-for-profit foundation, a 501c3, and they have a lot of information on lifestyle and what you can do about it. And they also can help you get the test. They have a program for people who do not have insurance or can't afford the co-pays. They'll work with you, okay?
That's really good, especially with today's healthcare system. That's what I was mentioning before, and with a preventative. I mentioned before my father had a major coronary attack and passed away, unfortunately. That was in 2000. Mm-hmm. So with him, he was unhealthy, though. He just grew up that way. So
yeah.
Going back to when you decided to study to be a doctor and go into your expertise, was there a reason? Or?
Yeah, I had the Marcus Welby syndrome. It was an old TV show, and I wanted to go out and cure everybody. And then you go through medical school and you realize that is a lot of paperwork, and there's a lot of focus on treating disease. And I was always interested in trying to keep people from getting sick. So I actually was a member of a heart transplant team 30 years ago, and I realized that most of the disease we were treating was preventable. So I said, I don't want to live my life like this. So I split off and said, I'm going to do something different. I'm trying to figure out how to detect disease early and prevent it. And that's what you saw in our meeting tonight, the GuardaHeart 5th Annual Unmask Heart Disease, that we have a lot of doctors who are now buying into what we call preventive cardiology and preventive medicine. And we also think that integrative doctors, anti-aging doctors, and people that actually listen to the patient do really well. And those are our colleagues. And we hope to get a lot of doctors trained to learn how to prevent heart disease rather than just giving you a drug, which is essentially a Band-Aid, covering up the fact that you're not doing the right things for yourself.
And really quickly, I know there's sorry, we got fireworks in the background. I know you have a very great group of people here, and they're from different areas of the world, like India and Asia.
Right.
How'd you all end up connecting?
Well, it's interesting. 90% of heart disease worldwide is due to lifestyle, and we've found a lot of like-minded doctors in other countries. So I should tell you that our GuardaHeart Foundation it has chapters in other countries, and the First Nation chapter. It has virtually every religion and race represented in it. and everybody that works in the GuardaHeart Foundation is a volunteer. 100% of the funds donated to the GuardaHeart Foundation go back to the community in one form or another. And the group that developed the Puls Cardiac Test is also the same way. The company is employee-owned. It has no professional investors, and it's all dedicated. It's more of a mission than a business, and we hope to keep it that way. And so that's what we do.
That's great. Now, is there anything else you would like to tell the audience, like where to find you, any other like tips for prevention, etc.?
Well, I think the most important thing is that if you just keep in mind what I said earlier, that 90% of heart disease is due to lifestyle, and what that means is that it's in your power to do something about it. Don't just go to the doctor, get a pill, and come home and think everything is okay. What you need to do, and I would really encourage you to go on the GuardaHeart website, look at what simple things you can do to actually turn your life around. And I want to stress it's never too late. As you heard tonight, we had a couple of 75-year-olds really improve their health in a very short period of time. We had a young girl, 24, who was diabetic, who is now not diabetic just based on lifestyle and the right kind of exercise and food. And so we just want to encourage you never to give up, and you really need a community to help you, so get your friends involved too and work together. And don't think you have to go to the gym for 4 hours. Don't think you have to go on a diet. Simple things in the U.S. like just avoiding sugar and refined carbs will do a lot for you, and a little bit of exercise, primarily resistance training and walking, are just perfectly fine.
Great, thank you. We appreciate your time, and thank you for having us here today. And we look forward to seeing you around and trying the product. Hopefully, I would like to. Actually, I would love to try the product.
Yeah, no, thank you very much. It's great. Thank you for having us.
Thank you.